Hello everybody and welcome to another adventure on Wonder Melly's English Planet. Students, today we're going to talk about something very important. We're talking about health, and we're talking about our symptoms. Students, right now we are in the middle of a pandemic, so health is the number one thing that everybody's worried about. It's difficult to explain to the doctor what you're feeling and what your symptoms are if you don't speak English very well. If you live in the United States, maybe you have an interpreter who can help you, but sometimes you don't have an interpreter. So what do you do? How do you explain to the doctor? So today's video, I'm going to explain 15 symptoms for when you go to the doctor to explain how do you feel, and then I'm going to talk about some expressions with the verb hurt. Okay, so these are 15 symptoms to explain to your doctor how do you feel. So the first one that I'm going to talk about is cough. Let's say it together. Cough. One more time. Cough. I have a cough. And this is a cough. I don't really have a cough, but that is a cough, right? Not a coffee, because sometimes people say coffee. Coffee is what you drink in the morning. This is a cough. So you can tell the doctor, I have a cough. Or my child has a cough. So remember, we can use have or we can use has. I have a cough. My daughter has a cough. My husband has a cough, right? So that's number one, cough. Number two that I'm going to talk about is fever. Let's say it, fever. One more time, fever. Fever is when your temperature goes up, right? So if it's very hot and your temperature is up, you have a fever. So you can tell the doctor, doctor, I have a fever. My daughter has a fever. My spouse has a fever. So I have a fever. So students, be careful because fever could be one of the symptoms for COVID or coronavirus. So if you have a fever, you have to tell your doctor. There's a song called Fever. It's a very famous song, and I love that song. It's one of my favorite songs. And it goes, you give me fever when you kiss me, fever when you hold me tight. I'll stop now. It's by Peggy Lee, and there's a version by Madonna too. So you can practice with that song. You give me fever. So fever when your temperature is up. So fever. The opposite of fever, sometimes you feel very, very cold. Okay, and if your temperature doesn't go up, it goes down, and you feel cold. You feel very, very cold. So that means you have the chills, okay? So let's say the chills. One more time, the chills. So you can tell the doctor, doctor, I have the chills. I'm very, very cold. I feel very cold, right? Or my child has the chills, right? So the chills. The next symptom that I'm going to talk about, number 4, is a runny nose. One more time, a runny nose. One more, a runny nose. A runny nose is when you need a tissue or a Kleenex and you can't breathe. Sometimes you call that a stuffy nose, and it's terrible. So when you need to have a tissue, I should have a tissue around here, a tissue we say blow your nose. So you have a runny nose. Your nose won't stop running. So you can tell the doctor, doctor, I have a runny nose, or a stuffy nose, or my child has a runny nose, or my wife has a runny nose. Okay? So the next symptom that I'm going to talk about is nausea. Let's say it, nausea. One more, nausea. When you feel nausea, you feel like you're going to vomit, like you're going to throw up, like bleh. I will not do that again. So you can say, doctor, I have nausea, or my child has nausea. So it's a symptom. Maybe you ate something that wasn't good and you're feeling sick, so maybe you have nausea. Another symptom that could be, I think it's in rare cases, but it could be related to COVID, but it's a rash. Let's say it one more time. A rash. One more. A rash. So a rash is when your skin is irritated, okay? So if you notice something in your skin and your skin is irritated, you can tell the doctor, doctor, I have a rash, or my child has a rash, okay? So a rash. Another symptom is dizziness. Let's say it, dizziness. One more, dizziness. When you feel dizziness, you feel like everything is moving, like, oh my God, what is happening, right? So you feel like stars around your head, like the room is moving. So I have dizziness, right? Or I feel dizzy. You can tell the doctor. So I have dizziness, my child has dizziness, or I feel dizzy, like everything is moving. Another thing that I'm going to talk about is your eyes. So you have to look at your eyes and be careful with your eyes. You can say conjunctivitis. This one is difficult. So I will say it again. Conjunctivitis. One more time, conjunctivitis. Or pink eye. Students, when your eye gets really red, or maybe pink, but if there's redness in your eyes, you can tell the doctor, doctor, I have conjunctivitis. It's a difficult one, so you have to practice that one a lot. Or my child has conjunctivitis. Students, this could also be a symptom related. I mean, I'm not a doctor, so you have to check with your doctor, but this is for you to be able to explain to your doctor, okay? So should we do it one more time? I want to do it one more time because it's very complicated. So conjunctivitis, right? If you have a problem with your eye and your eye is very red. So now I'm going to talk about some other common ones. So this one is very common. So you can say a headache. One more time, a headache. One more, a headache. So you can say, doctor, I have a headache, or my child has a headache, or my sister has a headache, my husband has a headache maybe. So a headache, right? So a headache, not a headache, because a lot of people make that mistake. I know that there's a CH in there, and sometimes it's a sh sound, but for headache, it's like a k sound. Okay, so this can be confusing for some people. Now, you can say, I have a headache, but you can say, my head hurts. Okay, so now I'm going to explain using the verb hurt, or hurts, right? So you can say, my plus body part plus hurt or hurts, right? If it's singular, my head, how many heads do we have? We have one. So you can say, my head hurts, right? With an S at the end. So singular, we add an S to the verb. My head hurts. So two ways of saying this, I have a headache or my head hurts. Okay, so it's a very common symptom, right? The next one is chest pain, okay? One more time, chest pain. Chest pain. So students, if you need to review the parts of the body, I have some other videos about the parts of the body. So we're going to talk about some parts of the body now. But this is your chest, okay? And if you have chest pains, students, this is a very, very serious, okay? Don't be like, it's okay. No, it's not okay. If you have chest pains, go to the doctor immediately, right? Go to the emergency room, call 911, do something. But chest pains, it could be very serious. It could be a heart attack, it could be COVID, it could be something. But it's very serious. So this is your chest. And if you have chest pains, or your child has chest pains, or your wife has chest pains, or somebody in your house has chest pains, is very serious, okay? So you can say, I have chest pains, or you can say, my chest hurts. Same thing, my body part hurts. In this case, we have one chest. So, my chest hurts, okay? And this is an emergency situation, students. I want you to please take it very seriously. If you have chest pains, if your chest hurts, okay? Promise that you're going to go to the emergency room. Okay, the other one is sore throat. Let's do that one. Sore throat. One more time. Sore throat. Look at the TH. It's a TH sound, right? Sore throat. So your throat is inside, right? Right here. So I have a sore throat. Right? It's very uncomfortable if you have a sore throat, right? You have to take medicine or maybe a spray. But you can tell the doctor, I have a sore throat. Or my child has a sore throat, right? Like when you swallow, like it doesn't feel good, it hurts, okay? So you can say, my throat hurts, okay? My throat hurts. Throat, we only have one, so my throat hurts, okay? So you can say, I have a sore throat, or my throat hurts. The next one, students, I have that one right now. I have a backache. One more time, backache. One more, backache. And it could be your upper back or your lower back. I have a backache, students. I don't know, when you get old, you have a lot of backaches. So right now, I can say, doctor, I have a backache. It's so bad. Or my child has a backache, or my husband has a backache, or my wife has a backache. So backache, similar to headache, it's not backache, it's backache, right? Like headache. When something aches, it's painful, something hurts in your body, okay? So that's called an ache. So we say backache. Or you can say, my back hurts, okay? My back hurts. We have one back, okay? So you can say, my back hurts. I have a backache or my back hurts. Okay, this one is very common too. This one is a stomach ache. One more time, stomach ache. A stomach ache. That is not good, students. It feels so bad. When you have a stomach ache, maybe you ate something that is not good. Maybe you have a virus. Maybe something happened. I don't know, but a stomach ache. So you can say, I have a stomach ache. My son has a stomach ache. My daughter has a stomach ache. Or you can say, my stomach hurts. One more time. My stomach hurts. We have one stomach. Cows have 4 stomachs, but we have one. So we say, my stomach hurts, okay? Or I have a stomach ache. It's very uncomfortable, so you have to explain to the doctor. The other one that I'm going to talk about is a toothache. One more time, a toothache. One more, a toothache. So a toothache is when you have a problem with a tooth or with your teeth, right? And you have to go see the dentist. We don't say a teeth ache. We say a toothache. Or you can say, my tooth hurts. If it's one tooth, okay? If it's many teeth, you can say, my teeth hurt. No S, because teeth is plural, okay? So let's do that one again. I have a toothache. Or I can say, my tooth hurts, if it's one tooth. Or you can say, my teeth hurt. No S, because teeth is plural. Okay? So practice that one. And the other one that is also very uncomfortable, students, these are terrible. I've had all of these. So it's not good. The other one is an earache. An earache. One more time. An earache. So when you have an earache, you can say, I have an earache. My child has an earache. My son has an earache. My wife, my spouse has an earache. And similar to stomach ache, backache, right? Earache, right? Toothache, not earish, because sometimes people say earish, but that is not correct, okay? So anything that's ache, it means that something hurts in your body, okay? So an earache, you can also say, my ear hurts. But let's talk about this one. If you have, if it's only one ear, right? You can say my ear hurt or hurts. My ear hurts with an S, right? One ear, singular, we add an S. But what if it's the two ears? I don't know, maybe you have a big infection. Hopefully not. So if it's the two ears, you can say my ears hurt or hurts. My ears, plural, hurt. Okay? So my ears hurt. My ear hurts. Okay? So singular, S, plural, no S. For the verb. So one more time. My ear hurts. My ears hurt. Okay? So I think that's 15 symptoms that you can use to explain to the doctor. But now I want to use other expressions, because if something else in your body hurts, you can explain it to the doctor, and you can use hurt or hurts. But remember, my body part, hurt or hurts, depending on singular or plural. So let's try this one. What if I say my hand? My hand hurt or my hand hurts? It's my hand hurts. One hand hurts. Okay? So my hand hurts. What if it's the two hands? Two hands. My hands hurt or hurts? My hands hurt. Two hands. Okay? My hands hurt. Okay? My hand hurts. My hands hurt. No S. Okay? What about, I'm not going to show you my feet, but what about if I say my foot? One foot. My foot hurts. But if I say my feet hurt, right? So my feet hurt, my 2 feet. So let's say if you're at your job and you're standing all day and you're very tired, you can say my feet hurt. Okay. Another one that you can say, maybe my neck hurts. Okay. My neck hurts because it's singular. We only have one neck. You know, sometimes students, like, you sleep in like the incorrect position and your neck hurts. Oh, that's terrible. So maybe if you sleep in the wrong position, your back hurts and your neck hurts, and when you get old, everything hurts. But okay, students, I'm going to stop there for today. So these are some symptoms that you can talk about with your doctor when you have to go to the doctor. So you don't need to use the interpreter, right? So one of the main reasons that people want to learn English is to have a conversation with your doctor. That is very important, especially now during a pandemic. Okay? So if you have any of these symptoms, please go to your doctor, go to the clinic, get a COVID test, get tested for other things, and check with your doctor. Okay? Especially if you have chest pains, go immediately to the doctor. So as always, students, please, please, please wash your hands. Wear your mask. Where's my mask? I have a mask around here. Maybe if you can wear 2 masks, wear 2 masks. Stay far away from people. Stay home if you can. We have the vaccines now. So if you can get the vaccine, get the vaccine. It's a great thing. The more of us who can get the vaccine, the better. And the faster that we can, you know, get back to a little bit of normal life. Okay? So please, please, please protect yourselves. If you like this lesson, as always, hit like, hit subscribe, tell your friends, tell your sister, tell your brother, tell your cousins, tell, I don't know, the lady at the supermarket when you go. And hit like, hit subscribe, and I will see you next time. Bye-bye, everybody.